I saw this early on, and I've seen proof of it, where they have a vaccination thing, looks like the size of a bottle of soda, poured into a little child's body.
Now that's nonsense. All of us parents know that. A vaccination that's the size of a soda bottle, I mean, that's a lot. That's silly and insane, right? And by the way, Trump, when it came out to, what this is, how much? Well, this is the soda bottle, and we got actually a little syringe here just so everybody could see it. So we can just for purposes of accuracy here, my eyes aren't so good, but I will show you the soda bottle that the President of the United States is referring to, and the single dose 0.5 ml.
Welcome back to Clips News, where we break down the biggest stories dominating the national headlines. Tonight, we're taking a deep dive into a major CNN broadcast covering President Donald Trump's controversial new executive order regarding childhood vaccines. In this segment, host Erin Burnett unpacks the administration's dramatic proposal to alter the recommended vaccine schedule, contrasting political claims with established medical science. You will see Burnett use a striking visual prop to fact-check statements made in the Oval Office, alongside a look at raw footage of Trump and HHS Secretary RFK Jr. discussing autism research. Furthermore, we examine expert insights from public health physician Dr. Chris Parnell, who joins host Audie Cornish to explain the critical science behind vaccine timing and herd immunity. Let's jump right into the coverage.
I saw this early on, and I've seen proof of it, where they have a vaccination thing, looks like the size of a bottle of soda, poured into a little child's body.
Now that's nonsense. All of us parents know that. A vaccination that's the size of a soda bottle, I mean, that's a lot. That's silly and insane, right? And by the way, Trump, when it came out to, what this is, how much? Well, this is the soda bottle, and we got actually a little syringe here just so everybody could see it. So we can just for purposes of accuracy here, my eyes aren't so good, but I will show you the soda bottle that the President of the United States is referring to, and the single dose 0.5 ml in one MMR vaccine, the one that has been falsely accused of being linked to autism. So there you go. Trump's dose, reality. They're pretty different. Well, Trump was asked then, where are you getting your information?
As the coverage unfolds, host Erin Burnett zeroed in on a particularly striking claim made by President Trump during a recent Oval Office event. In the broadcast clip, Trump described childhood vaccinations as massive doses poured into a child's body, dramatically claiming that a single shot resembles the size of a whole bottle of soda. To directly address this claim, Burnett turned to a visual demonstration right in the CNN studio. Holding up a full 2-liter soda bottle on screen next to a standard 0.5 milliliter syringe used for the MMR vaccine, Burnett provided a stark visual comparison between the president's description and actual medical reality. The segment highlights how quickly political rhetoric can diverge from standard medical practice when discussing public health policies. Burnett noted that the MMR vaccine, which protects against measles, mumps, and rubella, contains a tiny fraction of a fluid ounce, far from the large volumes described by the administration. By placing the physical objects side by side on camera, the broadcast visually disproved the soda bottle comparison for viewers. This moment sets the tone for the rest of the report, emphasizing the growing divide between official executive order messaging and established scientific facts regarding pediatric care.
How are you doing on the autism research?
We will have an answer for you. We just got
It's so important.
There's nothing to get, but that hasn't stopped them from tying vaccines to autism and a lot of other things for years and years.
The child, a beautiful child, went to have the vaccine and came back, and a week later got a tremendous fever, got very, very sick, now is autistic.
Well, I do believe that autism does come from vaccines.
There are certain groups of people that don't take vaccines and don't take any pills that have no autism.
There's no vaccine that is, safe and effective.
It's one of the most infamous lines ever said by RFK Jr. Elena Trine is out front at the White House. And Elena, you're learning that Trump went ahead with this today, despite warnings from multiple advisors, right?
Moving deeper into the broadcast, the visual shift brings focus to the key figures driving the administration's new health policy. CNN aired footage from inside the Oval Office featuring President Trump directly questioning Health and Human Services Secretary RFK Jr. about ongoing autism research. In the clip, Trump asks about the progress of these studies, reinforcing his long-held belief that a link exists between childhood immunizations and developmental conditions, despite decades of medical research finding no such connection. The commentary highlights the central role RFK Jr. plays in shaping the administration's public health agenda. Known for his years of vaccine skepticism prior to joining the cabinet, RFK Jr. is shown reassuring the president that answers will be delivered. The segment includes past clips of both leaders making sweeping assertions about vaccine safety, including RFK Jr.'s previous public statement questioning whether any vaccine is fully safe and effective. By pairing these archival clips with current White House interactions, the coverage illustrates how personal skepticism at the highest levels of government is translating into tangible federal policy shifts that directly affect national healthcare guidelines.
Very simply, large amounts of vaccine, large amounts of like vats of vaccine are currently pumped into your child's body. And I saw this early on, and I've seen proof of it, where they have a vaccination that looks like the size of a bottle of soda poured into a little child's body. And bad things happen in too many cases, because this is an explosion, this is an epidemic.
Okay, meanwhile, you had Republican Senator Bill Cassidy, who's a doctor, saying this on social media. He says breaking up vaccines will mean children have to get more shots to get the same protection, not fewer shots, and that it will increase hesitancy and make children safe. So help me out, because I'm already confused, right? Like, first I hear we're getting a lower number of shots, then someone says actually it's more shots. Like, what is the difference here?
Yeah, I think it's most important to first say that babies' immune systems are very strong, very smart, and can handle the commonly recommended vaccine schedule. Children are exposed to anywhere from 2,000 to 6,000 immune-triggering substances that we call antigens every day. And before this executive order, children were being exposed to 165 antigens through vaccines, which are like beginner books, right? Priming and pumping the immune system to function. So when you change that vaccine schedule, when you break up MMR, or you say that flu or COVID is not recommended, you take the commonly accepted vaccine schedule and you spread it out.
In the final highlighted segment, host Audie Cornish brings in Dr. Chris Parnell, a public health physician and director at the NAACP Center for Health Equity, to break down the medical science behind childhood immunization schedules. Replaying the president's comments about large vaccine doses, Cornish asks Dr. Parnell to address the common confusion parents feel when faced with multiple recommended shots. Dr. Parnell reassures viewers that an infant's immune system is remarkably resilient and naturally handles thousands of environmental antigens every single day without issue. Using a clear analogy, Dr. Parnell compares the antigens in vaccines to beginner books that gently prime and train a child's immune system to recognize real diseases. He explains that breaking up combined shots, like the MMR, or delaying doses actually puts children at greater risk. Spreading out the schedule requires parents to make multiple extra doctor visits, increasing the likelihood of missed protection and undermining herd immunity across communities. Dr. Parnell emphasizes that these schedules are grounded in decades of rigorous research designed to safeguard public health. Thank you so much for tuning into Clips News. If you found this breakdown informative, please make sure to hit that like button, leave your thoughts in the comments, and subscribe to the channel for more daily news analysis.